brilliant epidemiology for the University of Minnesota who did a landmark trial back in the 60s called the 7-Country Study, looking at 7 countries in the world, and he concluded that if they lived in a country bordering the Mediterranean Sea, that lifestyle, which was largely a plant-based lifestyle with occasional meat on rare occasions, nothing processed. But one of his conclusions after this exhaustive 10 years trial showing significant benefit and showing that if you followed this type of dietary plan, you reduced your risk of a heart attack by 90%. Well, he concluded that if some developed countries can do without heart attacks, why can't we? By the way, Ancel Keys, for those of you that served in the military, you'll know the term K-rations. The K from K-rations is from Keys, who developed that, and he died last year at the age of 100. Brilliant man. But modern man is genetically maladapted to his present environment. Here's modern man, sitting and watching The Sopranos as he's got his Coca-Cola and his potato chips, and he's walking his dog here. We really should be more like hunter-gatherers. Now, these two fellas, if they, like I said, in the Mediterranean, it's not that you can't eat meat. And we're going to have a debate about what's the optimal diet. I say we go back to our genetic roots. And yeah, we had red meat on occasion, but the red meat wasn't highly processed. It was, free-roaming animals. And it took us maybe 2,000 calories to kill the elk or the deer to get 1,000 calories of red meat. Today, forget it. You get in your car, you can get a 3,000-calorie meal at any of your fast food store or the grocery store with red meat without expending 50 calories. But the bottom line is that we really know that a hunter-gatherer type diet, which is natural and unprocessed food, foraged and hunted from the environment, trumps an American diet. It's got more fiber, more unsaturated fat, more omega-3 fat, certainly more potassium and less sodium, and on and on. And this is a very important statement down here, because the ongoing epidemic of cardiovascular disease is in part due to the striking discrepancies between the diet we are designed to eat and what, in fact, we eat today. So the Mediterranean diet is truly a modern-day hunter-gatherer diet. What is it? It's whole grains instead of processed grains. It's fruits and vegetables and nuts and beans and cold water fish that bring omega-3 fat to the table. Extra virgin olive oil. We now also have other forms of unsaturated fat oils and canola oil and flaxseed oil, which has omega-3 in it. Low-fat dairy. Here's your red meat. Remember, lean red meat a couple times a month. Somebody who really likes to have a good steak, then go out and eat your steak once a month, twice a month. But don't do what the typical American does. Gets up and has bacon or sausage for breakfast, hamburger or hot dog for lunch, steak or meatloaf for dinner, and gets up the next day and does it all over again. I wish I had more time. I would tell you all of the data as to why that's bad. So a Mediterranean diet does a lot of good things, and as opposed to a toxic American diet. Trans fats clearly have been a real problem. What are trans fats? They're partially hydrogenated oils that we stick margarine and Crisco, and we know they're toxic. The omega-3 fat, clearly 9 out of 10 Americans are omega-3 deficient. And why is that a problem? Because it leads to a lot of disease states. We can now measure your omega-3 level. Remember I told you at the beginning that what we are not doing is we're not getting the proper blood tests. Remember I said this is a metabolic disorder. I could tell everybody in this room whether your omega-3 level by measuring your blood EPA and DHA is normal or low. And if it's low, it's the simplest thing to correct. It's like putting water on a dying plant. You'll spring back to life, because what we know is that, clearly it increases your risk of a heart attack if you're walking around with not enough omega-3. You can eat more cold water fish, or you can take fish oil supplements, but we know that works. Here's the U.S. Physicians' Health Study showing significant benefit from just one fish meal a week compared to those that don't eat any fish at all. The fact of the matter is that's important. Refined sugar, we also have a big problem. The year 1900, the average American, 5 pounds per person per year, 2,150 pounds of refined sugar per person per year. And it all is the refined sugar in food. It's not that you're consuming all this. It's in the food. Leads to diabetes, leads to all kinds of conditions. This was actually a 1-hour lecture that I gave, My Beef with Beef. And I can tell you it really is a problem. Half the antibiotics that are consumed each day are the antibiotics that are in red meat. Here's the study that we discussed. Week 5, we're almost there. Week 5 is knowing your numbers. So here's a patient, Max, who had some chest pain. I saw Max a couple of years ago, and he was told that he needed a bypass operation, and he refused. He said, I don't want the bypass surgery. I have some chest pain when I exercise. I said, well, your other option is to go the heart attack-proof regression approach. And I put him on a Mediterranean diet, and I counseled him about regular exercise. Initially, he was in cardiac rehab. I made sure that he did the stress management techniques. And I'm going to show you, this was his initial lab work, which looked pretty good. This was just his cholesterol numbers. If it's green, it's good. If it's red, it's bad. He only had one little problem out here. But when you got the expanded thing that I was talking about that looked at the metabolic parameters, these are looking at how many particles. It lit up like a Christmas tree. His bloodstream was loaded with particles. And as a result, what we understand, this was his inflammatory blood tests that we measured that were elevated. Here's was his vitamin D level. I don't have enough time to talk about vitamin D, but we know if you're deficient in vitamin D, significant increase of a heart attack. Easy to replace. Here's his omega-3. He was deficient in omega-3. So he had all these problems. By correcting omega-3, you reduce risk 90%. I got him to the dentist. I got him exercising. I got him doing all of these things. And follow-up blood tests looked absolutely perfect. We shifted from all these red colors to green. And, clearly 3 years later, he underwent a repeat cath. And here's his artery 3 years later. Perfectly normal-looking artery, resolution of previously noted plaque. This happens every single day. We can do this. We can regress plaques. Certainly the other numbers are important, is knowing your blood sugar, your blood pressure. Clearly, these are things that knowing your BMI, which is different than your body weight. Just go to a chart, look up your BMI. You should be walking around with a number of 22 or 23. If you're 26 or 27, you're overweight. If you're over 30, you're obese. You could do something about it. Here's your inflammation numbers. You should know your inflammation numbers. You should get your CRP. And if you're walking around with chronic inflammation, it can be treated. It should be treated. You will lower your risk of heart attack. There's ways of preventing, some of these metabolic derangements, such as giving vitamin D for those who are deficient. Aspirin we give for people who are at risk. Who's at risk? Clearly for men over the age of 45 to prevent their first heart attack. Women, interestingly, not to prevent their first heart attack, but to prevent stroke over 65. Or all men and women if they've had prior heart attacks, if there's no contraindication to aspirin. Fish oil we talked about. And what does all this mean? I love this quote. This means that nobody's going to live forever, but the quality of life while you're alive is important, because life is not measured by the number of breaths you take, but rather by every moment that takes your breath away. And certainly what I can tell you is that this works. This was in a little small village on the island of Crete. A couple years ago, they interviewed Demetrius, a Greek peasant who turned 100. This is from the village newspaper. And they said, Demetrius, what's the secret to your long life? And he said, I walk every day, I work in my garden, I eat fresh food from the earth and the sea, and I enjoy my midday meal with a glass of wine surrounded by my family and friends. Well, Demetrius, I couldn't say it any better. And I'd like to close my talk today with a quote from a Chinese medical text, Huangdi Naiqing. In the year 2600 BC, a Chinese doctor wrote this. 2600 BC. And it still applies today. And I read this as a medical student, and it always impressed me, and it always stuck with me. And what he said was that inferior doctors tend to treat the full-blown disease, whereas mediocre doctors treat the disease before it becomes evident, but superior doctors prevent the disease. And I honestly believe that we can prevent the number one cause of death worldwide. And we can do it with an aggressive prevention approach. And I certainly feel that this meeting has become the premier meeting, not only in the United States, but worldwide on cardiovascular disease prevention. And with that, I thank you very much for your attention. God bless.